Hi everyone, my name is Katie Falloon and I'm excited to be joining you for this month's IBD Journal Club. Today we will be talking about an article by Dr. Bernstein and colleagues entitled Persistently High Rate of Venous Thromboembolic Disease, or VTE, in IBD, a population-based study, which was published last month in AJG. First, a little bit of background. Based on prior population-based studies, including the original University of Manitoba cohort study from the 1980s and 90s, we know that IBD increases the risk of VTE. In fact, we changed our practice guidelines based on this and other studies, and VTE prophylaxis in patients with acute severe ulcerative colitis is now part of standard of care. In addition, VTE is most common in patients with active IBD, and given our vastly improved armamentarium of drugs over the past couple decades, one would anticipate the rates of VTE have fallen. The aim of this study is to identify whether rates of VTE have actually declined and to identify risk factors for VTE. To perform this study, researchers identified patients with IBD from the University of Manitoba database via a validated algorithm. 11,262 IBD patients were identified, and these were matched in a ratio of 1 to 10 with controls, based on age, sex, and geography. Overall, just a couple points I want to draw your attention to. The incidence of VTE in the cohort dating back to 1984 is 7.6. IBD patients develop VTE at a younger age than controls. Incidence is higher in Crohn's disease than in UC, but age-standardized incident rate ratios were similar and were also similar across genders. VTE diagnosis is associated with increased mortality rate in both IBD cases and controls, highlighting the importance of VTE in our patient population. The authors performed a multivariate logistic regression to identify risk factors for VTE, and I've summarized those they identified as predictors of VTE on the slide from lowest to highest hazard ratio. You can see that predictors include comorbidities, less than 3 years of consistent anti-TNF use, steroid use, hospital admission, cancer history, and steroid use plus an anti-TNF. Keep in mind that while the authors looked at data for ustekinumab and vedolizumab, they did not have enough patients with VTE after initiation of either of these agents to include in the analysis. What's most intriguing about this study, I think, is the trajectory of VTE rates over time. You can see that in this cohort, age-standardized incident rates decreased at a rate of 0.74%, which, while statistically significant, was not particularly high. The authors propose a number of possible explanations for this, including that perhaps we as physicians aren't as good at prescribing prophylaxis in either the inpatient or outpatient setting as we should be, that our IBD meds may be procoagulants, that we aren't giving them early enough, or that we were giving them in the sickest patients most likely to clot anyway. They also note the possibility that the effect size is too small. Overall, the strengths of the study include the more than 30 years of follow-up in a stable population and the thoughtful analysis and interpretation of the data. Limitations include that the original cohort study was only conducted in inpatients, not all comers as in this study, that chart review was not performed to confirm the diagnosis of VTE due to ethical considerations, that the authors could not adjust for increased testing for VTE or assess inpatient utilization of prophylaxis, and finally, that only a small subset of the cohort received an anti-TNF, and that authors could not assess VTE rates for vedolizumab or ustekinumab, and tofacitinib was not included in this study, so the picture with regards to biologic agents is still a little bit unclear. Overall, the take-home points are that IBD is associated with increased risk of VTE. Key risk factors include hospitalization and the combination of steroid and anti-TNF. VTE rates have not changed much over the years. More data is needed on biologics other than anti-TNFs, and more research is needed to better understand why VTE rates are not more dramatically falling. And I look forward to hearing your thoughts. Thank you.